Hi, and welcome to Naptime Nutrition. I'm Yafi Lvova, registered dietitian nutritionist with Baby Bloom Nutrition, and with me today is the fabulous Elisheva Weiner, CCC, SLP, and if you want to know what that is, well, the CCC is just clinical competence, and SLP is speech and language pathologist. So we are going to be talking today about feeding your baby, because Elisheva is a feeding specialist, and that goes really well with dietitians because we can both attack the same issue from different angles. So let's start with babies. Okay, so I spoke with a lactation consultant a while ago about breastfeeding. I've spoken with a couple actually, so you can reference those if that's your current struggle. It's good to be in contact with an IBCLC. But what happens when you've chosen to breastfeed your baby, but you also want to give a bottle to, have a little freedom or something? How can you help the baby to take the bottle?
Okay, so firstly, thank you for that warm welcome and thank you for having me. So it's really important to first really understand the difference between babies. Okay, so if you're introducing a bottle early on, let's say in the marker 0 to 1 months, the baby's anatomy is very different. Okay, they have a lot of fat in their cheeks. Their tongue is, takes up most of their mouth. And this is all done purposely because babies really need a lot of protection when learning how to feed. So you'll see that your baby in the beginning, and this is the reason why, you could feed your baby laying down, because your baby is able to have all the safety mechanisms to be able to swallow. So if you're introducing the bottle very early on, it's going to be a little bit different than if you're introducing it later on. One of the things that I tell most people is really to make sure, if you're breastfeeding and introducing a bottle, to make sure that the nipple that you're using on the bottle is similar to that of the breast. It is common for babies to have nipple confusion, which means that they get confused between the different sources that they're getting their food. So you want to make sure that it's as close as possible. This way it can set them up for success. If a pacifier is being used, that also should be in conjunction with, the nipple should be consistent throughout. So you want to keep that in mind as well.
So you want the pacifier nipple to look the same as the breast nipple, to look the same as the bottle nipple in order to improve your chances.
Exactly. And they make so many companies out there. There's no right or wrong. You just have to find what works for you.
It's so interesting. So the thing is that nutrition is for so many different reasons. When we're talking about the breast versus the bottle, we're talking about straight nutrition. But there are other reasons why a baby might feed. And if you're having trouble introducing the bottle, you might want to think about, is your baby feeding so often because they're hungry? Or is it more for comfort? Are they experiencing some tummy distress or some reflux? Is there something else going on? And the bottle isn't going to provide that same level of comfort. The bottle can effectively give nutrition, but if you've been breastfeeding a child for comfort, they're not going to get that skin to skin from the bottle, and they're not going to get the same type of endorphin rush from the bottle as they would from the breast. So a child who's been feeding for those reasons might have trouble taking the bottle when you try to introduce it.
Yes, and that's also important to keep in mind, that you may want to put the breast milk into the bottle. This way, it also keeps that consistency, and they also get the nutrition benefits.
Right. And something that I've advised women is, if they're having trouble giving a bottle, it's good to take a couple drops of the breast milk and put it on the baby's lips or the baby's tongue in order to clue them in, this is what's coming.
Yeah, that's a really great one. And that's actually fits into the baby's sucking and suckling reflex. So I actually would tell a lot of parents to touch the baby's tongue, and with the breast milk would be a great option to do that. And just touch right on the inside and just get the reflux going. So this way they know and they're prepared and they're getting their suck ready.
Right. So if you're having trouble getting your baby to take a bottle, it might be worth it to talk to someone who's a professional who could help analyze the reason why your baby's having trouble taking a bottle and help you move forward in a happy and safe way. so that you can have a little me time, because it's so important. It's so important to have our self-care. I talked to Gila Glassberg about self-care, and we talked on another nap time nutrition about mini vacations, and it's really difficult to do when your baby is feeding very frequently and you have no other options. So should you be having this struggle, definitely get in contact with a dietitian, with a feeding therapist, whoever can help you figure out the best way forward for maximum happiness.
Yes.
So on to our next mini topic, when to start feeding solids. And this is a really big controversy because we've been all over the place with medical recommendations over the past 100 years. At some point, it was actually advised to start feeding solids on the 3rd day of life. And that's so foreign a concept to us now, because what most doctors are recommending is about 4 to 6 months. What I recommend is 6 months, and not usually much before. If you're dealing with a baby who was born premature, you're going to have to account for that prematurity, and you might be feeding later than 6 months. You might be feeding quite a bit later. It depends on the readiness signs.
Yes. Okay. So there are a few readiness signs you want to look for when your baby's ready to feed. I like that you recommend also starting a little bit later at the 6-month point, because babies, just like people, come in all shapes and sizes and different forms, and some babies are ready a little bit earlier and some babies are ready a little bit later. So it's always important to make sure you're looking at the readiness signs and you know that your baby's ready, because you don't want to introduce solids too soon and have a negative reaction or a negative association. So the readiness signs to look for is if your baby's sitting up independently.
Mm-hmm. And that doesn't mean that they can get themselves to a seated position, because that happens much later. It means you put the child down and they can support themselves.
Exactly.
I wanted to clarify that.
It's also really important to make sure that you're looking to see if their tongue protrusion or tongue thrust, when they stick out their tongue, is starting to get less often. It doesn't have to be away, but it should be less often. And they should be able to hold on to things and start grasping. And definitely a big one is that they should be looking interested in food and eating. That baby that's sitting on your lap while you're eating and watching, with their eyes, the food on the fork going to your mouth, and they're watching. That's a readiness sign.
Right. Or if they just try to grab food off your plate.
For sure.
Pointing and screaming, that's definitely a sign. But the tongue thrust thing, that's really, all of these things point to the fact that your baby can physically reach food, bring it to their mouth, put it in the front of their mouth, and move it to the back of their mouth. That's where that tongue thrust comes in, and swallow it safely. So with the tongue thrust specifically, what that means is you want to make sure that the baby's tongue isn't sticking out when they're trying to swallow, because they need to be able to safely move food from the front to the back. The reason we got into this whole puree thing was because when they were advising feeding between 3 days and 4 months, babies can't physically pick up food and swallow it. You had to use purees. You had to put it on the back of their tongue because they weren't physically able. And now we know there are risks, not only at that time, but long-term risks of feeding kids food too early. There are increased risks of allergies, increased risk of diabetes and overweight. A lot of issues come from feeding kids too early, and we're just finding out more and more that support the idea of waiting until that 6-month mark or until the readiness signs.
Right. And then the parent really has to make the choice, how are they going to start introducing these solids? So there are 2 approaches. There's the spoon-fed approach, which, mostly deals with the purees, and that's where the parent is spoon-feeding the child and putting the food physically in the child's mouth. And then there's the baby-led weaning approach, which is where you give your baby solid food and the baby is able to pick it up and put it in their own mouth and self-feed. So these are 2 different approaches. They both have benefits and they both work on different skills, which is really important. The spoon-fed works on the swallowing skill. Okay, so it's more of, when the swallow gets triggered, how to, push the food back into the mouth to get the swallow triggered and get it down, as opposed to the baby-led weaning approach, which really focuses more on the oral stage, which is getting the food to the mouth independently, and then, figuring out what to do with it once it's in the mouth, more of the mastication, chewing process. So they work on different skills, which is why they're both really important. So I tell my clients, there's no one right way. most parents, have to do what works for them, but I really do recommend a dual approach.
Right, I totally agree with that. And for convenience sake, it's best to have both on hand. And I did a nap time nutrition on those pouches specifically, because while we're saying that purees are a perfectly valid way to feed a child, if you feed specifically with those pouches, you're really not developing those skills that Elisheva is talking about. You're only working on the suck, which they have mastered from breastfeeding or bottle feeding. So that doesn't contribute to them working on those muscles and working on those skills that Elisheva was talking about. So while those pouches may be convenient and you can use them, here and there, it shouldn't be the sole source of nutrition.
Yeah, I agree with that.
Yeah, and the other thing is that when you do purees, you can feed the child, or you can load the spoon and have the child pick up the spoon and feed themselves. That's not going to work with, say, a pear puree, because it's very liquid. That's not going to be a good thing to start. You can use maybe a thicker mashed potato type of consistency that'll stay on the spoon and be a little bit less high maintenance. You want to build the baby's confidence as well, and if everything's falling off the spoon, that's not going to contribute to their
yes.
image.
And I would also add, be mindful of the tools that you're using. So what kind of spoon are you giving the baby to use? They make so many different products these days, so many ways to set your baby up for success. You can really, find a spoon that's really good, that keeps the food on the spoon and hopefully get something in the mouth.
Yeah. Do you have any products that you recommend specifically?
So I actually love the Ola Baby Sprout Spoon, which is the baby's first spoon. It's a silicone spoon, which really has a great shape that holds the puree on the spoon. It also is very flexible, so it allows when the baby pushes down into the bowl, if they are trying to get it on themselves, it really sets them up to be able to get something on the spoon no matter, where it is in the bowl. So I really love the Ola Baby Sprout Spoon.
Yeah, and the truth is that even if you're a hardcore baby-led weaning fan, which I am, we as adults eat purees also. We eat applesauce. I eat a lot of ice cream. We have mashed potatoes, for example, I mentioned. We have purees in our adult diet. So it really does fit in with baby-led weaning to teach them purees as well. It's also convenient if you're out. If you're out of your house, it's, can you imagine doing baby-led weaning at, Gymboree? It's, you don't want to subject other people to that mess. So baby-led weaning, first step, get a dog. And you can do that at home, and you can have another method when you're out for convenience sake. And it's a totally healthy way to approach feeding. And the truth is that I've done a number of segments on stress and how stress affects digestion. And the baby's going to pick up on your stress. So if you're choosing a method that stresses you out, your baby's going to pick up on that. And there could be consequences for that as well. So you want to calm down, choose something that works for you, make sure that it's good for your whole family, and pursue that, and in a calm and happy, positive fashion, because that's really a good way to pass on food is positive to kids. And that's really the whole idea.
Definitely. And I think it's also really important for people to note that, as much as it's, a nice idea to introduce food, and we said, maybe wait until the 6-month mark, wait for readiness signs, it's also important not to wait too long, okay? Because these are really important skills that your baby needs to learn right now. And you probably know, and can speak more about the nutrition aspect. Right now, in terms of nutrition, their primary nutrition should be from the breast or from the bottle. However, when they turn age 1 and come 12 months and on, they need to get nutrients from food. And if they haven't been exposed to feeding, and if they haven't been exposed to these skills and learned these skills, they're not going to be able to be successful in terms of their nutrition. Is that correct?
Yes. So that whole saying, food before 1 is just for fun. While that is accurate as far as nutrition, it is definitely not accurate as far as feeding, and also development of the muscles that you need for feeding and for speech as well. So you want to wait until that 6-month point or readiness signs, but you do want to start it then. You don't want to delay it, because at that point, it is important for social skills as well as that muscle development, taste and texture exposure, There's a lot that goes on between that 6 and 12 months that make food very important. Nutrition isn't necessarily one of them.
Yes, and you don't want to hold your baby back because, I do have parents who come to me and they say, my baby's not eating, but now the doctor's getting concerned, the pediatrician's concerned. And this is kind of like they missed the window. And it's very important to, close in on that and make sure that you're introducing it at the right time.
So it's very important at the 6-month mark that you do introduce food. You can see it as an activity at the beginning, but you're going to start to progress toward meaningful nutrition so that by the time the child is 12 months old, you can switch to food first and then the breast and then the bottle. But you really do want to introduce food before that mark. So we did mention baby-led weaning, and I'm, as I said, a big fan of that. And the reason is that it's one of the few times when you as the parent can be lazy and still be doing the right thing. So you do want to make sure that the food isn't too salty and that it's appropriate and it's appropriate size. But you can introduce anything. If there's a history of food allergies, you want to discuss that with the doctor because you'll take things more slowly. If there's a family history of allergies. But if there's no family history of allergies, you can proceed a little bit quicker. And you can even start with meats if that's something that your family is into. If you're going to give steak, you want to give a strip that's like this, fits in their palm and in their grasp, comes off the top a little bit, and they just gnaw on that. The truth is that is a good source of iron, and iron is one of the very few nutrients that's actually important at that 6-month mark. Most food is not going to be meaningful nutrition until you hit about 12 months, but vitamin D and iron are really starting to deplete at that point, and the breast milk does not provide that. So it's important to make up for that with the foods that you do consume or that you do give the baby. So a common concern with baby-led weaning is on choking and gagging. So can you talk about the difference between choking and gagging?
Absolutely. It's really important to note that there's a vast difference between gagging and choking. So gagging is actually, elicited from the gag reflex, and that is a protection mechanism. Okay, that's supposed to keep the baby safe. So if food is getting too far back too soon without control, then the baby will gag, and this is to protect its airway. So to make sure that choking does not happen. So if you see your baby gagging, it's really important not to get alarmed, not to have any sort of negative reaction, because you don't want to teach your baby that gagging is something bad, and you don't want to teach your baby that feeding is bad. You want them to have a positive experience with feeding. Choking, on the other hand, that's when the food is actually in the airway. Okay, so that's when it's penetrated, the aspiration can happen at this point, and that's when the baby is going to try to get it back up and may need help getting it back up. So it's very important that parents also, get trained in CPR, and they know the signs to look for, any turning colors of the face, any gasping for air. These are signs that say your baby's choking. A gag, normal, that's fine. It's great. Your baby's doing their job.
So when an adult gags on something, it's right before they choke. Is the same true of babies?
So with babies, it's actually, as I mentioned previously, when babies are very young, the gag reflex is very forward in the mouth. As they get older, everything kind of moves back and down and is elongated. So the gag reflex should move back as well. Actually, one of the common problems that I see and one of the issues that I treat is when the gag reflex is too far forward and the gag is being elicited when it's not necessarily needed. So it's important to note that it's safe for a baby to have food and to have these gag reflexes, and it is the safety of your baby. That's why they're gagging. It is right before the choke happens, but usually with the gag, they get the food out, which is what it's there for.
Right. So the gag actually teaches the baby how to take an appropriate bite, which is an important skill moving forward.
Especially with baby-led weaning, yes.
Yes, especially with baby-led weaning, but they get to work on that with baby-led weaning. So that's
exactly, and that's a really important skill.
Yeah. Okay. Great. So where are we? So what are some other common feeding concerns that you've encountered?
Okay, so the biggest thing I see is with babies that are premature, because a lot of the reflexes that go on really occur in gestation, and usually, the various different weeks, it really depends on which reflexes we're talking about. But if you have a premature child, chances are that it could be that some of the reflexes weren't developed appropriately, and that's where we come into problems when it comes to feeding. So they may need more time, as you mentioned previously. Another common issue that I see is low muscle tone. If a baby has low muscle tone, it's going to be a lot harder for them to feed safely. That doesn't mean that it's not possible. It just might be harder because they don't have the proper muscle tone to help them. It's also really important that babies have the suck, swallow, and breathe rhythm. Okay, so if that rhythm is off, you're going to see feeding issues as well. That's primarily also with breastfeeding and bottles. That suck, swallow, breathe is really important. And then there's the hypo and the hypo gag reflex, which is really fascinating one. When the baby's gag reflex is either too forward in their mouth, so they're gagging on something too early when it is really safe, or when they're gagging on something too late and the gag reflex is too far in their mouth. So that's a really interesting one that I see, which is a lot of just, getting the baby to be able to recognize that gag reflex either a little bit later or a little bit earlier, depending on which one.
That's really fascinating.
Yeah.
So if you have a concern for your baby's feeding or your baby's growth, keep in mind that nutrition is really determined by a child following their growth trajectory. I also did a segment on growth charts. So if you have a concern about your child's growth, check that out. Talk to your pediatrician. Get in contact with the dietitian if that's your concern. If you are concerned about your baby's feeding, the actual mechanics of feeding, get in contact with a feeding specialist like Elisheva, and you can talk to your pediatrician about a referral for that as well. They should probably have some names on hand. But if you have a concern, please say something, get it addressed. So thank you for joining me, Elisheva. This was really nice.
Thank you. Yes, I had such a great time. Thanks for inviting me on.
Sure, and stay tuned for the next Nap Time Nutrition, as always, Tuesdays at 1 o'clock Arizona time, 4 p.m. East Coast time, 1 o'clock West Coast time. We don't change the clocks here, so I get confused. And follow me on Instagram, Pinterest. I don't do Twitter. And if you're local, come to Toddler Test Kitchen. We have a summer session coming up where we're doing recipes around the world. And Elisheva, if they have any questions for you, where can they find you?
You can find me on Instagram at Elisheva Weiner. Feel free to reach out to me, direct message me. I'm there.
Great. Thank you so much, and see you next time for Nap Time Nutrition.